In this episode of our Clinical Series podcast, we will be presenting the topic on gout. First of all, we will be providing you with an overview about gout. Gout is a type of arthritis that is characterized by sudden and severe joint pain, redness, swelling, and tenderness. It occurs due to the buildup of uric acid crystals in the joints, resulting in inflammation. Here is a general overview: clinical manifestations, signs and symptoms, treatment, and prevention options from a medical perspective. Overview. Gout is caused by high levels of uric acid in the blood, which can be due to various factors like genetics, diet, obesity, certain medical conditions, or medications. When uric acid levels become too high, it can lead to the formation of urate crystals that accumulate in the joints. Gout most commonly affects the joints in the big toe but can also involve other joints, such as the ankles, knees, elbows, wrists, and fingers. Clinical manifestations. During a gout attack, individuals typically experience sudden and intense joint pain, often accompanied by swelling, redness, and warmth in the affected area. The affected joint may become incredibly sensitive to touch, making even light pressure unbearable. The pain tends to be most severe within the first 24 hours of an attack and gradually subsides over several days to weeks, with the joint returning to its normal state between flare-ups. Signs and symptoms. The hallmark signs and symptoms of gout include: 1. Sudden and severe joint pain, typically affecting the big toe, but can occur in other joints. 2. Swelling and tenderness. The affected joint becomes swollen, red, and extremely tender. 3. Limited range of motion. Movement and function of the joint may be impaired during an attack. 4. Fever and chills. In some cases, individuals may experience low-grade fever and chills during an acute gout attack. Treatment. Treatment for gout focuses on managing the symptoms during acute attacks and preventing future flares. Common treatment options may include: 1. Medications. Nonsteroidal anti-inflammatory drugs, NSAIDs, colchicine, and corticosteroids can help relieve pain and reduce inflammation during acute episodes. Long-term medications like urate-lowering drugs are also prescribed to manage uric acid levels and prevent future attacks. 2. Lifestyle modifications. Changes in diet, weight management, and reducing alcohol consumption can help lower uric acid levels. Increasing fluid intake, particularly water, may help flush out excess uric acid. 3. Rest and elevation. During a gout attack, resting and elevating the affected joint can help reduce pain. How to prevent gout. To help prevent gout or manage the symptoms of gout arthritis, here are some general recommendations. 1. Maintain a healthy weight. Obesity is associated with an increased risk of developing gout. Aim for a balanced diet and regular exercise to maintain a healthy weight. 2. Stay hydrated. Drink plenty of water to help flush out uric acid from your body. This can help prevent gout flare-ups. 3. Limit purine-rich foods. Foods high in purines can increase uric acid levels in the body. Limit or avoid consuming organ meats, seafood, such as sardines, mussels, and anchovies, red meat, and alcohol, particularly beer. 4. Include low-fat dairy products. Studies have shown that low-fat dairy products, such as skim milk and yogurt, may reduce the risk of gout. Include them in your diet. 5. Moderate your alcohol intake. Alcohol consumption, especially beer and hard liquor, can increase uric acid production and decrease its excretion. Limit your alcohol intake or avoid it altogether. 6. Choose complex carbohydrates. Foods rich in complex carbohydrates, such as whole grains, fruits, and vegetables, may help lower uric acid levels and reduce the risk of gout attacks. 7. Avoid dehydration and fasting. Dehydration and fasting may increase uric acid levels in the body and trigger gout attacks. Ensure you stay hydrated and maintain regular meals. 8. Discuss medications with a healthcare professional. If you have a history of gout or are at high risk, your doctor may prescribe medications like allopurinol or probenecid to help manage uric acid levels. Remember to consult with a healthcare professional for personalized advice and guidance tailored to your specific needs and medical history. What are the foods that must be avoided to prevent gout? There are several foods that are known to be high in purines, which can contribute to elevated levels of uric acid and potentially trigger gout attacks. It's important to note that these recommendations may vary based on individual circumstances, so it's always recommended to consult with a healthcare professional or a registered dietitian for personalized advice. Here are some common foods to limit or avoid. 1. Organ meats, liver, kidneys, and sweetbreads are particularly high in purines. 2. Seafood, anchovies, mussels, sardines, scallops, herring, and trout are some examples of purine-rich seafood. 3. Red meat, beef, lamb, and pork, especially when consumed in large quantities, can contribute to elevated uric acid levels. 4. Game meats, venison, rabbit, and other game meats tend to have higher purine content. 5. Certain fish, tuna, haddock, salmon, and cod can be moderate to high in purines. 6. Some vegetables, asparagus, spinach, cauliflower, and mushrooms have moderate to high purine levels, but these can still be included in moderation as part of a balanced diet. It's important to note that dietary modifications alone may not be enough to manage gout. Other lifestyle changes, medications, and individual factors need to be considered. How gouty arthritis differ from osteoarthritis and rheumatoid arthritis. Gouty arthritis, osteoarthritis, and rheumatoid arthritis are three distinct types of arthritis with different causes, clinical manifestations, and treatment approaches. Here is a brief overview of each. Gouty arthritis, also known as gout, is caused by the accumulation of urate crystals in the joints. It typically affects one joint at a time, most commonly the big toe, and is characterized by sudden, intense pain, redness, swelling, and warmth in the affected joint. Gout attacks can be triggered by consuming foods high in purines, such as red meat, shellfish, and alcohol, or having certain risk factors like obesity, genetics, or certain medications. The treatment of acute gout attacks includes nonsteroidal anti-inflammatory drugs, NSAIDs, colchicine, or corticosteroids. Long-term management focuses on lifestyle changes, such as weight loss, a low-purine diet, maintaining hydration, and taking medications like allopurinol to lower urate levels. Osteoarthritis, on the other hand, is a degenerative joint disease that commonly affects weight-bearing joints such as the knees, hips, and spine. It is caused by the breakdown of cartilage, resulting in pain, stiffness, reduced range of motion, and sometimes joint swelling. Osteoarthritis typically develops gradually over time due to age, joint overuse, obesity, genetics, or joint injury. Treatment options for osteoarthritis include pain management with analgesics or NSAIDs, physical therapy, exercise, assistive devices, joint injections with corticosteroids or hyaluronic acid, or in severe cases, joint replacement surgery. Rheumatoid arthritis is an autoimmune disease characterized by chronic inflammation of the synovial joints. It primarily affects the small joints of the hands, feet, wrists, and ankles symmetrically. Rheumatoid arthritis causes joint pain, swelling, stiffness, deformity, fatigue, and systemic symptoms. Treatment involves a multidisciplinary approach, commonly including disease-modifying antirheumatic drugs, MARDs, like methotrexate, biologic agents that target specific immune cells or molecules, NSAIDs, corticosteroids, and physical therapy. Early diagnosis and intensive treatment can help slow disease progression and preserve joint function. Regarding diet, in gout, it is generally advised to avoid or limit intake of high-purine foods such as organ meats, shellfish, red meat, sugary drinks, and alcohol. In osteoarthritis and rheumatoid arthritis, there are no specific dietary restrictions. However, maintaining a balanced diet, maintaining a healthy weight, and consuming foods rich in omega-3 fatty acids, antioxidants, and anti-inflammatory properties, like fruits, vegetables, whole grains, lean proteins, and fish, can contribute to overall joint health.